Have you noticed how expensive healthcare can be in the United States? A quick trip to the doctor or short stay in the hospital can cost a ton of money, way more than most of us can afford. And let's face it, we never know when we might get sick or hurt, right? That's where health insurance comes in. It helps make those big bills a lot smaller, so you don't have to stress about paying for medical care. In this video, we'll talk about health insurance, unpacking how it works and what factors to weigh when choosing the right plan for you. Here's how health insurance usually works. You pay a monthly fee, called a premium, to an insurance company. This fee helps spread out the risk among lots of people, like you, who are also paying premiums. Since most people stay healthy most of the time, the money from these premiums can cover the medical costs of the few who do get sick or hurt. Insurance companies are experts in understanding and managing risk, aiming to collect enough premiums to cover everyone's medical expenses. In the US, there are tons of different healthcare insurance plans with different rules and setups for care. High-deductible health plans, or HDHPs, are becoming popular due to their higher deductibles and lower monthly premiums. Enrollees in HDHPs can open health savings accounts, or HSAs, providing significant federal tax benefits. In 2024, an HDAP has deductibles of at least $1,600 for an individual, or $3,100 for a family, with total out-of-pocket maximums of $8,050 for an individual and $16,100 for a family. HSAs allow pre-tax contributions for qualified medical expenses, offering a triple tax benefit: deductible contributions, tax-deferred growth, and tax-free withdrawals for healthcare costs. Government programs like Medicare, Medicaid, and CHIP offer health coverage to seniors, people with disabilities, and low-income families. The Affordable Care Act, or ACA, signed into law in 2010, expanded Medicaid, prohibited insurers from denying coverage for pre-existing conditions, and allowed children to stay on their parents' insurance until age 26. It created the health insurance marketplace for finding affordable plans covering essential health benefits. While the ACA initially imposed penalties for lacking insurance meeting federal standards, the penalty was removed after December 31, 2018, by the Tax Cuts and Jobs Act. Additionally, a 2012 Supreme Court ruling removed the ACA's mandate for states to expand Medicaid, leading some states to opt out. Medicare covers individuals aged 65 or older, certain disabilities, end-stage renal disease, and ALS. CHIP provides health coverage for children under 19 in low-income households. When choosing the right health insurance, consider these three key questions. 1. Where can I get care? Health insurance plans regulate costs by determining where you can seek medical attention. These places, called providers, encompass doctors, hospitals, labs, and pharmacies. Many plans have a network of providers who offer services at reduced rates to plan members. Going to a provider outside your plan's network may result in limited coverage or higher costs. What's covered in the plan? Healthcare reform, such as the Affordable Care Act, standardized benefits across insurance plans in the U.S. Previously, plan benefits varied widely, with some covering prescriptions while others didn't. Now, all U.S. plans must include essential health benefits such as emergency services, hospital stays, lab tests, maternity care, mental health treatment, and prescription drugs. 3. How much will I pay? Figuring out the costs of insurance can be tricky. Remember we mentioned paying a premium to join a plan? That's the upfront cost you know about. But take note that with most plans, that's not all you'll pay. When you actually use the plan to get care, there are usually more costs involved. Firstly, there's the deductible, which is the amount you have to pay out of pocket each year before your insurance kicks in. And there are federal limits on how high this can be. Additionally, there are co-pays, which are fixed fees for specific services like doctor visits or prescription drugs, which you have to pay even after meeting the deductible. Then there's co-insurance, which is a percentage of healthcare costs you have to pay even after meeting the deductible, but only until you reach the out-of-pocket maximum for the year. Generally, plans with higher out-of-pocket costs have lower monthly premiums. When choosing a plan, it's important to balance lower monthly payments against the potential risk of higher out-of-pocket expenses in case of a major illness or accident. Unlike some countries, the United States lacks a universal government-run healthcare system. Instead, it operates on a complex framework of subsidies and tax benefits that render healthcare reasonably affordable for many individuals, most of the time. Thanks for watching our video on health insurance. We hope you found it informative and helpful in navigating the complex world of healthcare coverage. Don't forget to like this video if you found it useful. Subscribe to our channel for more insightful content, and hit the notification bell so you never miss an update. Remember, staying informed about your health insurance options is key to making the best decisions for you and your family. See you in the next video!